So the product of choice that you're using again is Restylane.
Yes. Good old Rusty.
Good old Resty. We used to call it the grandfather of fillers because it was really the first out of the box. And again, starting lateral on the cheek.
Yes. Try not to change my ways too much.
At least your injection ways. So here we go.
This is the first linear dermal weakness that's interesting.
Right. Small stick and away we go.
And then we get to know his face. This is middermis.
Middermis, and you're feeling the resistance on the plunger right now. It tells you sort of the robustness of the dermis in this situation. He's got, I would say, above average thickness for his skin.
Oh yeah, beautiful thick dermis.
Mm-hmm.
It's getting thinner as we go up.
And again, notice the technique. I love the technique of way the plunger is at the base of the thumb and he's squeezing the product. You can't control product like that by doing it from the tip of your thumb, from the pulp of your thumb. It's got to be a squeezing motion using the small muscles of the hand rather than a pushing motion using the long tendon, which comes from a muscle in your forearm. So that pulley system can't control product, and he's really depositing very small amounts of product as he's doing this.
You don't need a lot of force.
Especially with that needle. It's a ultra thin wall needle, right? The
Yeah.
29 gauge on the outside and a 27 gauge internal. It's that little technique that you actually engage the needle and then lift the skin up slightly, and then when you inject, or you're injecting retrograde like a swoosh, you just sort of pull it back.
And the pulling down of the skin is just to make sure that I'm in the right plane. Because the position of the needle doesn't change if you do this. I mean, it's,
Right,
it's in the same tissue.
It's same tissue, correct. It's not like you're engaging the needle or pushing it forward, you're actually sliding it.
It's just for me to see where it goes. And sometimes, like in this area, you can see if you hit the right level, all of a sudden you see a blanching.
Little blanching,
in front of the needle.
Right.
That tells us that we're at the right level to press on the small arteries.
Right. Because he has some telangiectasia here that we can see.
Yeah.
So you expect that there's going to be a little bit of dermal bleeding. But look, it stops itself.
Now you see the difference. This is treated.
Right.
Then this weakness becomes more obvious.
Correct. Because it's abutting against the area that you've now increased the structure.
Absolutely.
So that's why it makes sense to start lateral and progress medially.
Yes, and do one direction first. Because you can imagine if you do this line, for instance,
Right.
and you make a furrowed pattern from one and into the other direction,
Right.
it will interfere with the visibility of this weakness.
So everything is away.
Yeah. And I always say to my students, it's like mopping the kitchen. You work in this direction and you walk in the other direction to be sure not to interfere with your visibility of weakness here.
Correct. And as you said before, I mean, do you expect that in a male patient that you would use perhaps a little more product than you would normally in a female? Or it's just a question of thickness of skin?
Thickness of skin, and as you see with him, because his skin is so thick, you don't need a lot of product in order to enhance the strength of the skin.
True. Interesting point.
We will need some product for volume, though.
Right. Yeah, the idea of trying to do this to correct a contour deficiency or volume deficiency is not exactly the technique that you would use, but it definitely is a technique that I would say that you do this on all your patients, correct?
Yeah. I mean, if you look at any aging phase, there's always...
Skin deterioration.
Yeah, and there's always irregularity in strength. So reducing that irregularity is always contributing to having a more
youthful appearance. Absolutely. Well, he's already young looking for his age. Not that he's advanced age or anything, but for his maturity, shall we say. And this is definitely going to give him a beautiful boost. There's no question. And the hair-bearing, skin in males a little trickier to deal with than the typical female?
Not really. It's.
You don't find the product can sometimes come out through the hair follicle, sort of?
Oh, it does, but it doesn't bother me.
In fact, that probably tells you you're at the right depth.
Yep.
It's amazing, just the minute droplets of product.
The only thing you see is that when you squeeze it, it does behave differently.
Right.
That's the only monitor you're looking for. As soon as you see the plunger move or you see the skin come up, you're putting in too much, and you're probably too low.
Yeah, I mean, I don't see a bump anywhere on the skin, and your mid-dermis is what you're targeting, I would
This
say?
whole mid-dermis.
Mm-hmm. And just filtering it down the marionette right now.
There's this little dermal weakness just adjacent. Got a lip line here.
Certainly no risk of vascular issues when you're sitting in the mid-dermis, I would
Absolutely
imagine.
not. That's why I feel so confident to go for the forehead in just a minute.
Right. Taking it right into the thickness of the chin, where you find the skin is a lot thicker, probably requiring a lot less product. I mean, you're already using microdoses, so you might be using nano doses of product now as you're going in that area.
And you see, I did see a post yesterday on Instagram about volumizing the chin for the chin line. I don't agree with that. If you make this movement, you see, I can judge this to be a linear dermal weakness rather than a lack of volume. So
Well, that would be like trying to blow up a tire to get rid of the tread. It doesn't make sense.
That's it. And it does work. I mean, if you blow it up
Enough.
enough,
Yeah, sure.
it does do the trick.
The
But
patient
it
looks
looks weird.
I agree. Make them look weird, you will be feared. So we're going into the forehead now, right over the glabellar line.
Yeah.
Okay. Starting the injection point from the actual line itself,
Absolutely.
and then heading a little bit lateral and perpendicular to it.
There you go. You see that line diminishes. And actually, when you see a pore that is deeper than I would like it to be,
Right.
that would be my entry point. You see the immediate effect on that line. Now for the sleeping line, I want to go to the other side because
Sure.
I think this side of his sleeping line has a thinner skin than that side.
Okay.
So in strengthening, I would rather strengthen the weaker
Side first, right?
and then do the thick side.
Sure. Let me scoot by you here from the other side. It's a good point to be made.
So a very tiny little one here. Let's do that.
Tim, you seem to be quite comfortable with the injections. I know that you had some cream put on, but if you were to say 0 was no pain and 10 was intolerable, what number would you give it?
2 or
2?
something
Yeah,
like that.
that's
It
what we
just
use.
feels like a pinprick.
That's all.
Yeah.
Like mosquito bites, I guess.
Yeah.
Mm-hmm. And that's what we want. I mean, we want it to be comfortable for the patient. It's the experience as well as the result.
And we have the means. I mean, the numbing cream. What you hear a lot is people say that, well, numbing cream doesn't work on me, but they had it on
For 5 minutes.
5 minutes, right?
Yeah, right.
um,
I know we were talking earlier about it. Do you ever go ahead and use any type of cellophane to make it occlusive when you're putting it on, or you just...
I do.
You do?
I do. Yeah.
Mm-hmm. And about a half hour, you said.
Yeah.
So a half an hour for the preparation and a half an hour for the treatment. I mean, patients are in your practice probably when they come in for that, they know they have to schedule out around an hour and a half, I guess, of their time, correct?
Yep. Yeah, so we give them the time of treatment. That's in the agenda, and they know they have to show up.
Half hour before for the creaming.
So my assistant does the creaming.
Mm-hmm.
So I will see them just beforehand, do a quick check, put them in cream,
Right.
and like intertwine it with other patients.
So now you're performing the other half of the fern, so to speak, I guess.
Yes, but I forgot this one.
So you're going to have to come backwards.
Or do a backhand.
That's it.
Just because I'm too lazy to walk all the way over there. And it's gone.
I find it's an area that we struggle with quite a bit. There seems to be, you know, not only a loss of structure, but the more cephalad structures, the more superior structures are resting down on it. Like the lip doesn't support the chin. It's that area that you're doing right now that supports the corner of the mouth.
Yeah.
So it's actually building from below or holding it up from below.
It's the support you need here
Right.
in order to...
And it's dermal support that you're providing, not support down on the bone.
well, the bone is very strong, and there's a lot of nothing in between and when it comes to support. And that's, the skin is very strong. So if I want strength, I go to the skin or to the bone. But since I cannot deal with the bone, I need to optimize my skin strength.
I think one of the things I'd love for you to look at in your patients is this thing that I talked about called dynamic discord. And what I was talking about when I was mentioning that was the fact that as we mature, our skin deteriorates, our muscles get weaker, there's no question, but our skin deteriorates at a faster rate than our muscles deteriorate. And so there's an imbalance in the pool of facial muscles.
Mm-hmm.
You have a tendency to overexpress yourself. We become caricatures, so to speak.
Yeah.
And we overgrin when we smile, we show our back teeth. But I bet with this technique of boosting up the end organ, which is the skin, that's why the muscles are designed to move the skin, that we have a more natural expression afterwards, that we express ourselves not as robustly, if you understand what I mean, that the smile, instead of showing all the teeth, now shows the front 6 or 8 teeth like it used to when we were younger. Yeah. So I bet if you were to look at these patients through animation, that you have treated that issue.
I agree, and we know that the muscle action diminishes after 60 or so.
Mm-hmm. Doesn't everything?
I don't know yet. But the thing is, if you look at old people, like I'm talking 75.
Mature people.
Mature people,
yes.
Right? Their expression is much softer. And I mean, the biggest patient group when we're talking toxins in reducing muscle strength is somewhere between 30 and 50.
Correct.
And after that, the necessity for reducing muscle strength is less.
But the necessity for building up dermal resistance is more,
Absolutely.
or to restore dermal integrity, as what you're doing over here. And we had mentioned in our earlier patient that, I mean, there's an initial result that you see, there's no question about it, but that the long-term effects are much more impressive. That you actually start to see collagenesis, as we were talking about it.
It's true rebuilding, yeah, on a dermal scale.
So one needle has taken you almost through half the face.
Yes.
Thicker skin, you might end up having to use 3 needles instead of 2?
Yeah, maybe 3. But he's not complaining, and there are 2 in the box, so let's try with 2.
Okay.
So we still see his nasolabial fold, which is perfect.
Yeah, I agree. I mean, not to have a nasolabial fold is actually simian in look. I mean, it looks like a chimpanzee, I should say. So that having some nasolabial fold is absolutely appropriate, and age appropriate as well. I'm just fascinated to watch you do this, even in the presence of the telangiectasia that he has over here, with, I'm seeing no immediate bruising or any type of really excessive bleeding. Because your little deposits in your channel that you're creating are basically tamponading.
Absolutely. That's one of the reasons I want the injection to last all the way out.
Right.
Because if you stop injecting too soon before you hit the dermis, you will see it bleeding.
You'll see the bleeding.
And of course, trying to originate your injections from the actual line means that you do need to inject all the way to that line, because the biggest weakness is in the line
In
itself.
the line itself, correct. So you're trying to make sure you do deposit stuff in the actual crease itself.
Yeah.
And the angle of approach, I notice on the needle, is very flat to the skin. I mean, it's maybe 5 degrees or 10 degrees off the actual skin surface. You can't come in more vertical, obviously, and perform this type of technique.
Well, if you look really, really closely, it will be a 90 degrees angle going in.
Okay, do it in slow motion so we can see exactly. So,
But it's not because I moved the needle, it's because I moved the skin.
so you're pushing the skin into the needle.
Yes. And this is a 90 degrees.
And that's also...
As soon as
yeah,
you're in, it's a 0 degrees.
Gotcha.
So you go from 90 to 0.
Because your free hand, or the smart hand as we call it, is actually pushing the skin forward. And that actually keeps the discomfort of the injection to a minimum, because you're actually moving the skin into the needle, which is much less noxious than actually pushing the needle into the skin. Part of the deal. Two-handed technique. It's like watching a concert pianist in motion here. Again, starting laterally and moving medially towards the nasolabial fold. But there are times that you will inject the nasolabial fold exactly like this if you feel that's a little too deep.
Absolutely. And mostly there's a medical reason for that. If you see nasolabial folds that are nasolabial folds that the patient feels bad about, if you take a close look at the skin, it might be acne scarring in most patients that evolved into wrinkles which are too deep for their age. And then it's actually logical and ethical, I think, to treat the nasolabial fold because it's a scar, because it's really a medical condition to begin with, and there's a reason for the patient not to be happy with it.
A lot of injectors are still treating nasolabial folds in a linear fashion, and they feel that they can fill the fold, but I never understood how you could fill something that doesn't have a bottom to it. It's not like it's sitting on bone, that, like a ditch that you have a bottom to that you can just fill up with dirt. So what you want to do is you want to plank it, you want to structure it across it, like you're doing with all these areas.
Yeah, and sometimes on top. There's
On the
room
piriform
for,
region.
On the piriform
I
region, there's a lack of volume that is contributing to
The depth of the fold.
to the fold, as the lack of volume here can
Right.
contribute to the fold.
For sure.
But if you move down, this is not a lack of volume, this is a lack of strength.
Correct. Yeah, we certainly wouldn't want to volumize in that area the way I look at it. And people think that they can use a cannula running underneath the dermis over there to provide some structure, which you can, but again, it's providing more of a trampoline underneath the skin than actually thickening the trampoline itself.
Yeah, that's the major problem with using cannulas, is that if you look at this
Needle
product,
injector.
if you look at this product, which is capable of giving volume and capable of giving strength, because you choose to place it underneath the skin or in the skin.
All but depending on depth, correct?
If you use a cannula, you cannot go in the skin.
No.
So you cannot give strength. So you lose half of the capacity of your material. And of course, cannula is great if you want to make money, because you can squeeze 4 mils of junk into somebody's face within 10 minutes easily. But if you're looking for good results, I think you need both the filling and the strengthening capacity of your hyaluronic acid.
That's a good point. Very good point. I mean, treating at multiple depths is something that we like to do because of the fact that we age at all the different depths, and people have been ignoring the skin. You know, it's amazing how the pendulum swung, and it swung from doing intradermal injections to all of a sudden everybody was doing deep injections and forgot completely about the dermis.
And there are reasons for that, and mostly economical reasons. I mean,
Yeah.
we're all here to provide for our families.
But, you know, getting along those topics over there, I don't suppose you charge per syringe, but you charge per treatment.
I charge per syringe. I'm
No kidding.
stupid. Yeah.
Wow. Well, we're going to have to change that. See, there's something that maybe we can sort of change in your practice over here, because this is a very time-consuming
But
procedure.
I charge a
isn't it?
lot, though.
Oh, that's better. I feel better now. I was starting to start to feel a little sympathy for you, but
And syringes are cheaper
mm-hmm.
in Amsterdam.
Absolutely. But what they're really paying for is they're not paying for the product, they're paying for the hand. I mean, it's like if you're an artistic painter, they don't pay you for the paint, they're paying you for your expertise, your experience, and it's the hand that's important. Absolutely.
And of course, I'm faster than I used to be. So I can
Do a patient in a half an hour where
half an hour.
Right. And this is about the speed that you would normally do it in your practice right now, that we're
A little. I would do it a little bit fast.
faster than this. Mm-hmm. Well, the result is quite impressive on the side that's been done over here. But the swelling will settle in, as you say, from the multiple needle sticks.
Yeah, I don't expect him to swell a lot.
Because of the thick dermis.
Yeah.
So what do you do in a patient who's a lot more mature? If you get patients who come in who are quite sun damaged
Mm-hmm.
and sitting in there more mature than me, let's say they're in their 70s. These are patients that want to look better. Can you use this technique, and would you use the standard Restylane that you're using right now?
I would switch to a thinner Restylane, Restylane Vital or Silk in the US.
Yes, correct.
Which does attract more water, has a bigger effect on the dermis on a biological level. So you combine the strength of the technique with a more active, biological active particle size, actually.
Right.
And you can do miracles with Restylane Vital because you get even more than you ask for. I mean, now we can see the effect. With Vital, you don't see the effect that much until you see the patient 2 months after or 6 months after. It blows your mind.
And it's at the time that you consider a second treatment as well. You do this usually.
Yeah.
And so you see all these patients that you treat like this, you see them at the 3-month mark, 2 or 3 month mark?
Yeah. And in your communication with the patient, that's almost idiot-proof also, because if I would say to him, okay, you spend $1,000 and I will make your nasal labial folds go away, that might be a problem, right?
Right.
If I say, okay, you're going to spend $1,000 and I'm going to strengthen everything that needs to be strengthened, and you come back to me in 3 months' time, and if you want to do another step, we go and go like that until you're happy with the result, and then I expect you to come back every year for a touch-up.
Right.
Then what I expect on a biological level would be aligned with what he expects.
As a result.
As a result.
Mm-hmm. Fascinating. So it's absolutely, it's aligning with the patient on their expectations.
Yeah, and I hate expectation management because, I mean, when you hear that, I say, well, why don't you do result management, right? Why don't you make the result as good as the patient expects?
Right.
Of course, if you say to your patient, I'm going to inject you 1,000 times and you won't see no result, that's expectation management, right?
Right.
But you can force yourself to be a better injector instead. not trying to disappoint them beforehand.
Yep.
This is where I feel he needs
Some volume. So what you're doing is straightening the dermis. It makes absolute sense to be able to do that, because trying to lift, for lack of a better word, floppy skin versus skin that has some substance to it, there's quite a difference in that.
Yeah,
Sort of
sometimes I
like-
make the analogy with when you get a present for Christmas and it's all wrapped and you can already see it's a bicycle.
Yeah, you kind of can see it is, yes.
What's the fun in that? I mean, and that's the same way you don't want to see the filler. So
Right.
you need that piñata to be adequate to contain whatever you put in.
Right.
So you need a good envelope
Absolutely.
before you fill it.
And now you're going for the volume,
This is for volume. This is on the zygoma.
right?
My needle is in loose connective tissue.
Right.
I trust this not to be an artery, so I can leave
Small bolus.
15.15 here. Let me see.
Yeah, a little bit of a different approach. With a female, you're not trying to create a feminine cheek on him, obviously.
No, what I like in men is it's like a diamond-shaped look. You have a strong chin, jawline, the zygoma, and I'm aiming more for a exaggeration of the push from the zygoma than an overall filling of the cheek, which is preferable in women.
So a little sharper definition of the bone structures underneath rather than just a mound.
Absolutely.
Yeah, and we like to see OG curves in both men and women, but in women it's sort of a gradual transition. We don't want to see any bony landmarks, but we don't mind that in men.
We like bunny landmarks in men.
In men,
and,
yeah, we do.
There's a lot of things we do like in men that are on the list of treatments. I mean, we look at the Sean Connery. I mean, there's labial folds, frown lines. He got what we call the party headlines. He has it all,
Right.
but still he's
Distinguished looking, handsome.
Absolutely.
Yeah.
handsome.
I wouldn't necessarily cover that for women, though. Women don't like to see that, I mean, on themselves.
Well, that's a saying. Well,
Right.
when men age, they start to look more like Sean Connery.
Right.
And when women age, they start to look more like
Sean Connery. That's correct, yes. Correct. And that's what we talk about. One of the aging features is the fact that there's a masculinization of women. Beautiful. One syringe of product, this type of result. Again, for the post-treatment management, you leave the little bleeders on the skin for a period of about 45 minutes to an hour, usually in your practice, correct? We might dab them off just for some photographs on him. No special indication for patients. They don't have to massage because they don't feel anything specifically over there. You just allow
They're
it to
not
work.
supposed
They
to.
can sleep on their face that night. There's not a problem. And then you see them back at about 3 months.
Yep.